And it's wonderful to be able to be here with all of you. Good morning. It's evening time for me here in Boston, but I'm so thrilled to have a chance to talk with all of you and to share some of the research that my colleagues and I have been doing. I will go ahead and share my screen. Great, it looks like it's working now. So the plan will be, I'm going to give a presentation for about half an hour talking about the findings from our national survey study, the Healthy Mind study, and looking at data both from students as well as from faculty on college and university campuses across the U.S. And so it will be primarily focused on the U.S. context, which is where our data are collected. But then we'll have time for Q&A and for discussion, and I'll be really interested to hear the reflections that all of you have in the chat or in the Q&A function about the state of mental health on your campus and what you're seeing among your students and faculty and staff. And in preparing for this and talking with Vivica and Vivian, it was clear that something that was key was kind of really practical solutions or actions that folks can take. And I am not a mental health professional, and I assume that the vast majority of you are also not trained mental health professionals, but there are, pretty simple things, but they're very intentional that we can do to shape well-being on campus. So I'm going to share some practical takeaways at the end. A little bit about me. I did my undergraduate work at Tufts University, and then I was at Harvard, where I was doing a master's in higher education and serving as a proctor. So I was living in a residence hall with first-year undergraduate students, and that's really where I came to think a lot about college student mental health and really opened my eyes to the prevalence of mental health problems on college campuses. And then I went on and I did a PhD at University of Michigan, where I combined higher education policy in the School of Education with mental health services in the School of Public Health. So really combining those, and at the intersection is mental health on campus. So that has really been my focus for more than 10 years now. And my colleagues and I have collected a lot of data that I will share with you. So just to frame our conversation, and this is something that I think there used to be even more I would receive questions around, like, why are college students an important population for us to think about with regard to mental health? Now, I think, particularly in the US, that question is not even asked as much because people are so aware of the problems that are going on campus, but it's still really important to underscore why this matters in the first place. So the age of onset is the first thing I like to start with. So 75% of lifetime mental illnesses will onset by age 24, meaning that many traditional age college students will experience their first signs and symptoms of a mental health problem while in college, or an intensification of an underlying concern that they had prior to starting college. So given that it's the traditional college years really overlap with the age of onset for mental health problems, there's an important opportunity for early intervention and prevention. We know that mental health problems become more and more difficult to treat the longer that they go on untreated. So if many people are experiencing their first signs and symptoms during college, if we can reach them with helpful mental health resources during that time, it has the potential to shape their long-term trajectory. Unlike for physical health, where when you think about conditions like, a broken bone, for example, where most people who have access to healthcare, if they break a bone, they will go into the hospital and have that assessed. For mental health, that's not the case. The median delay from the first time that someone experiences symptoms to the first time that they utilize treatment is about a decade. So 10 years from symptom onset to first treatment contact. And there are so many missed opportunities and negative sequelae that happen in that 10-year span. Mental health problems are also the most prevalent and the largest burden of disease of any class of health conditions among adolescents and young adults worldwide. And combining all of these factors, campus settings offer this really unique opportunity for prevention and intervention. It's a significant time from a developmental perspective, new peers, new social environments, new learning opportunities for students who are living on campus or away from their family for the first time, all of the transitions that come with being in college. And then there are so many human resources. I'll be interested in the Q&A to hear a little bit more about maybe the specific roles that folks have and what ways you're interacting with students. Because when we think about between faculty, academic staff, student life staff, advisors, the many staff who work all across campus, and then peers on campus, there are just so many people who see and touch the lives of students. And all of those human resources present opportunities for positively shaping student mental health and faculty and staff mental health, as well as identifying if someone is struggling and connecting them with services. And then lastly, mental health during adolescence and young adulthood is associated with pretty much every long-term outcome that we care about. So economic outcomes, educational outcomes, social outcomes, and I'll talk a little bit more about this, but this is the one slide version of why I think it's so important to be thinking about mental health on campus. So that's really what motivates our work through the Healthy Mind Study, which is our annual online survey study. It's the largest and most comprehensive survey of mental health on campus. And I'll talk a little bit at the end about opportunities to engage in this work. The surveys are open to campuses all across the world and all different types of institutions. We've had large public institutions, small regional schools, religiously affiliated institutions, community colleges, which are our 2-year institutions here in the U.S. So all open to all institutional types. And we run the survey every semester. So we're usually collecting data between September and December. And then we pick up again in January through about May. And we do this again online. We get random samples of students from every school that is participating. So we invite a sample of students at the campus to participate in the survey. And we use validated screening tools to measure mental health. So instead of asking a student, do you feel depressed or do you feel anxious, we're actually administering some of the same screening tools that would be administered in a healthcare setting. And I'll talk a little bit more about that. So there's 3 of us as faculty members who run and oversee all of the work at the Healthy Minds Network, which is our larger umbrella organization that oversees our survey studies, as well as a lot of our other efforts. And then we have this incredible team of staff who run the day-to-day operations. And then, of course, the students who are willing to give their time to participate in our survey and give us these data. So like I said, we use validated screening tools to measure mental health. We use a 9-item screening tool called the Patient Health Questionnaire 9 to measure depression, and a 7-item scale called the Generalized Anxiety Disorder 7 scale to measure anxiety. Another key mental health measure that I'm going to share about is suicidal ideation, which we measure by asking students in the past year, have you seriously considered attempting suicide? And that's a yes or no question. So I'm going to focus primarily on those 3 mental health measures to share some prevalence data and what we've seen over time. So this is sort of the bad news slide, and this is taken from hundreds of thousands of students on college campuses across the U.S., the largest sample of data on this topic. And what we have seen is a continual increase each semester and each year in terms of the prevalence of symptoms of depression and symptoms of anxiety. So you can see in 2013, 22% of students screened positive for symptoms of major depression and 17% for symptoms of anxiety. And in spring of 2021, which are our most recent data, 41% of students screened positive for depression and 34% for anxiety. What I think is really important to show here, that at least in our data, we have seen throughout the pandemic a continuation of a very troubling trend, as opposed to a unique spike that came out of nowhere. The trend line was already going up and the prevalence was already high before the pandemic in college populations, but we have seen an increase in that. And I'll show a little bit about some of the unique factors that the pandemic seems to have shaped. This graph is showing the prevalence of students who reported suicidal ideation in the past year. And you can see that in 2007, which is the first year that we collected data, the anxiety and depression that I just showed on the previous slide, we changed our measures that we use in the survey. So that's why I only included 2013 and on. But here you can see, 13 years of data, and you can see in 2007, 6% of students reported seriously considering suicide. And in 2020, 14% of students seriously considered suicide. So when I talk particularly to faculty, I think one of the things that really drives home the urgency to be thinking about student mental health in the classroom is that, at least in the US context, if you have a classroom of 100 students, the odds are that there are 10 of them who are at some point, really seriously thinking about suicide. 10 of them who are, really struggling. And I think that statistic is something that really resonates with faculty in particular. So increasing rates, something that the pandemic certainly has uniquely affected our experiences of loneliness and isolation. And loneliness and isolation are two of the most significant risk factors for suicide, along with financial stress, which is also something that the pandemic has uniquely affected. So you can see here, and this is based on a 3-item loneliness scale, that about 2/3 of students, more than 2/3 of students, report that they are experiencing loneliness or feel left out or feel isolated from others. I want to talk a little bit about help seeking for mental health and what we know about students' use of mental health services. And again, this is something I'll be interested in your questions and comments and reflections about this, because I know how much stigma around mental health really varies across communities and cultures and countries. In the United States, we have seen at a population level a continual decrease in rates of stigma. And with that, as shown on this slide, an increase in students' use of mental health services. So you can see in 2007, less than 20% of all students had received treatment for mental health problems in the past year. And in 2016, 2017, over 1/3 of students. Yet we still know that there is this significant treatment gap for mental health. And when I say treatment gap, I mean the proportion of students with a positive screen who are not receiving any form of treatment. So that's a way to sort of quantify need and an unmet need on campus is, what is this treatment gap? Which of our students and faculty and staff are getting resources and support, and which of those who are struggling are doing so without any resources? And you can see here that the treatment gap for depression is 63%, for anxiety, 61%, for suicidal ideation, 47%. So just over half, 53% of students who report suicidal ideation have received any type of treatment. Most students who do seek help do so in a crisis, meaning that there are already missed opportunities for early intervention. When students are coming in when they're in a crisis to the counseling center on campus, and therefore require more intensive services. And many folks end up being identified by peers or other quote unquote gatekeepers, which may be a term that many of you are familiar with, but essentially just means a non-mental health professional who has their eyes open and their ears attuned to looking for signs and symptoms of mental distress, and can intervene by asking someone how they're doing and try to connect them to services. So I think what we've seen in the pandemic is that the visibility of these gatekeepers has really been reduced. And a lot of that pressure has fallen solely to faculty. I know for myself, when my university went from in-person to remote in spring of 2020, my first class that I conducted on Zoom, was, just, we were all kind of in shock and sharing our reflections. And our second week, it was in that in-between time that I realized that I may have been one of the only people at my university who has seen my students. They weren't seeing the staff, they weren't seeing their peers nearly as much. And now, at least at Boston University, there are a lot more interactions, but still faculty remain some of the only folks who are really consistently seeing students. What we've seen in the US context also is that stigma has been going down, as I mentioned, and many students are really open to talking about mental health. We thought it was really important in the Healthy Mind study in our survey to understand how the pandemic has affected access to mental health services. And you can see that 38% of students say they don't know or they haven't tried to utilize services. But of those who have, 30% say that it's become more difficult for them to try to access services. So 30%, I should say 30% of all students indicate that the pandemic has made it more difficult for them to access mental health services. Probably the most stark change that we have seen during the pandemic in terms of mental health is how the students report that mental health has been affecting their academic performance. So we ask students, in the past 4 weeks, how many days have you felt that emotional or mental difficulties have hurt your academic performance? And prior to the pandemic, the rate of students who said none was closer to a third to even 40% of students who said, there have been no days in the past month where my mental health has negatively affected my academics. Now you can see just 18% of students in spring of 2021 said that their mental health has not affected their academic performance, meaning that 82% of students say their mental health has negatively affected their academic performance. And in particular, 27% of students are saying that this is the case on 6 or more days in the past month. I also know for myself as a faculty member that I have seen and had many more conversations with students over the past year and a half about how their mental health has been, preventing them from learning at their best or fulfilling assignments or just keeping up with readings. And again, I'm going to share some kind of practical tips for supporting students, but I've really been struck both in our large scale data from tens of thousands of students in the spring of 2021, as well as just from my one-on-one interactions with the students that I talk to, how much students' mental health has been affected and how much that is shaping their academic performance. Our team, particularly my colleague Daniel Eisenberg, who's an economist by training, and he's at the University of California at Los Angeles, he has led our work around how mental health predicts academic performance over time. So this is a separate but related set of analyses. And from that, he has shown that depression is associated with a twofold increase in the likelihood of stopping out or dropping out of college without graduating. And we've used this to build an economic case where we can show the amount of funds that can be put into prevention or intervention for mental health and what you will get returned in terms of tuition. And this is primarily for tuition-driven institutions. And the conceptual model here is if we reduce depression or if we reduce a mental health problem that a student is experiencing, we'll increase retention, which will increase tuition. And then there are also other outcomes here. We might increase student satisfaction, and that could lead to engagement of alumni and graduates. At a societal level, if we can reduce depression and increase education, that's also going to increase lifetime productivity and earnings and have positive effects for society. So this return on investment calculator that we've built, it's an online tool that's available to anyone at the link below. And I'm glad that this is being recorded, and folks should definitely feel free to check this out. It's a customizable tool. So you put in some information about the student body size at your institution, if you know your graduation rate, in your tuition rate, if you're charging tuition, and it asks for a few more parameters, and then it calculates what that return on investment would be in terms of dollars saved for investing in new mental health resources and programs. One particular area of investment in prevention revolves around training faculty. So faculty play an enormous role in shaping student success, broadly defined. We know that having a personal connection with a faculty member is associated with higher student satisfaction and higher sense of belonging. We know that having a supportive professor or advisor is associated with higher retention, and this is coming from a large body of higher education literature. Faculty are on the front lines in terms of being able to identify students in distress and refer them to help. And I think the past year and a half has shown that to be more true than ever. And the data that I'm going to show in just a moment, the takeaways are really faculty are having conversations with students about mental health. These conversations are happening already. Faculty have relatively low confidence in how to serve as gatekeepers, and very few of them have received formal training in how to do so. But many faculty are really welcoming of new resources. So these data come from a survey that we conducted in spring of 2021, focused on the role of faculty in student mental health. So this was a pilot study with about 1,700 faculty members who participated on 11 or 12 college campuses across the U.S., again, an online survey. And we collected some data about faculty characteristics, their knowledge and attitudes related to student mental health, their experiences related to student mental health and well-being, and their own mental health and well-being. And this work was made possible by partnerships with the Hazelden and Betty Ford Foundation and the Mary Christie Institute, and several of my colleagues who also led this work alongside me. So a few key findings from this. We found that 80% of faculty reported having one-on-one conversations with students about mental health. So the majority of faculty are having these conversations. The likelihood of having conversations varied by faculty academic discipline. So we found that faculty in the social sciences and the humanities and in the arts were more likely to have had a conversation with a student about their mental health, and faculty in business, law, science, and math were less likely. I think it's really important to pair this with what we know from our student data, which show that there are some higher prevalence rates for students in specific disciplines, particularly in the arts. But students in business, law, science, and math, the prevalence rates are still quite high there. And so there seems to be, maybe some particularly large missed opportunities for faculty in certain disciplines to play a key role. We also looked at how faculty having conversations with students varies by faculty gender. And we found that female and trans and non-binary faculty were more likely to have had a conversation with a student, and male faculty were less likely. When we asked faculty about their kind of confidence in having conversations with students about their mental health, you can see that about 50% of faculty say that they don't have a good idea about how to recognize that a student is in emotional or mental distress, or they're not particularly confident in that. But about 3/4 say that if they thought a student was experiencing distress, they would reach out to the student. So they don't feel confident identifying it, but if they did identify it or thought they had identified it, they would reach out. So pairing these two together really presents an opportunity for training. So we asked faculty about whether they would accept more training and kind of what they want in that. And more than 2/3 of faculty said that they are motivated to strengthen their role in supporting student mental health. About 3/4 agreed that they would welcome additional professional development on the topic of student mental health. A majority actually said that they think it should be mandatory that all faculty receive basic training in how to respond to students experiencing mental or emotional distress. And faculty, unsurprisingly, would prefer trainings that are online, trainings that offer advice for general student support instead of just crisis or suicide prevention training, and that these trainings be brief. In addition to trainings, faculty also wanted a list of mental health resources available at their institutions and in their local communities, a checklist of things to consider regarding warning signs of mental or emotional distress, a small reference guide for how to initiate a conversation with a student, and a statement on mental health to include in their course syllabi. I'll focus on that last example as a kind of low-hanging fruit, so to speak, something that I think all institutions could be doing, which is generating language that is consistent with, the mission and the culture of your institutions, but that says, we prioritize student mental health, and here are some of the ways that we're doing that. And if you have resources available on your campus or in your local community that you can make aware to students, sending that through faculty and requesting that they include it in their course syllabus is a way of reaching students and also educating faculty. I also wanted to mention what we know about mental health among faculty themselves. So you can see that about 1/3 of faculty screened positive for symptoms of major depression. And that seems to be particularly among faculty who said that supporting students in mental or emotional distress has taken a toll on their own mental health. So that's something to really be aware of, that there are faculty who are doing this work and attempting to support students, and that they're doing this work, but that it is taking a toll on them. About half of faculty agree or strongly agree that their institution should be investing more in supporting faculty mental health and well-being. And only 30% of faculty say that they know what mental health resources are available to them on campus, even though faculty report much higher knowledge of the resources that are available for students. So like I promised, some practical actions to support student well-being. I think that communication is key in all of this. Something that I like to do is to make my assignments due at 5 p.m. because that's a time that allows students to, have dinner and have, keep a good sleeping schedule. It prevents students from pulling an all-nighter, which if an assignment is due at 9 a.m., students are going to be much more likely to work through the night. And we know that sleep is really important for mental health and well-being. So not only do I make the time intentional, I also tell students why I'm doing that. And I tell them it's because I'm trying to shape our class in a way that is conducive to positive mental health and well-being. Counter to that, even though I'm talking about deadlines, I think having flexibility and conveying that, there are ways to ask for extensions and deadlines, and that there is flexibility is also really key, particularly during these really challenging times. And I know that on many of your campuses, you're really, really still, struggling with COVID and feeling that within your communities in a big way, and how that affects students and their families. And so we really need to bring some flexibility in how we're grading and determining our deadlines. Acknowledging this moment and how it might affect students and their motivation and their concentration and their performance. I was struck by, talking to students in the first, week or so who said, I'm so glad that my professors are, giving time at the beginning of class to just talk about mental health and how we're doing, and sort of checking in. And then we can have a really productive class after that if we do dedicate a little bit of time to acknowledging this moment and making students feel seen. Conveying that we know that there are students who are grieving and students who are experiencing economic hardship and managing so many other challenges. Just that recognition is something that I think faculty can bring into the classroom, and something that college leaders in communications with students and with their faculty and staff can just be acknowledging these challenges and making members of the community really feel seen. I mentioned being flexible with grading and deadlines, examples like dropping the lowest grade or laying out a process to request an extension, and trying to remove the shame that students feel when they do need an extension. I really try to give students the benefit of the doubt. I've always kind of brought that approach, but even more so during the pandemic. As I mentioned, including mental health resources in the syllabus, and noting that addressing mental health is likely to have a positive impact on learning and academic outcomes. That is one of the biggest motivations that we can give to students for them addressing their mental health, is to remind them that they're here to learn. We know that they're passionate about their learning and their education, and addressing mental health concerns may allow them to learn better and to perform academically in the ways that matter to them. So really reminding them of that, I think, is important. Making explicit the ways in which you're seeking to cultivate inclusivity. In the U.S. context, I think a lot about gender diversity in my classroom. I think a lot about how system level policies, racist policies in the U.S. are shaping students' lives, and really making space to acknowledge that and to ensure that students are feeling safe and included and valued in the classroom. And then telling students, I mean, it's really quite simple, but telling students that you care about their well-being, and trying to remind them of this. I can't tell you, the very simple things that I say, and I can't tell you how often students will come up to me and just say, like, it means so much to me that you cared about us as more than just, our papers in class or our exams. And I don't do much more than what I'm saying to you right now, which is just expressing to them that I care about them, and that I try to create a class that is supportive of their mental health. It's just being explicit about that, that I think goes a really long way. As I mentioned, I'm not a mental health professional. I assume that the majority of you are not mental health professionals, but these are some really simple ways that we can communicate to students that their well-being is important. This is a resource, and I'd be happy to send a link of this to Vivica, but it is made by my colleagues at an organization called Active Minds, which is a U.S.-based nonprofit that has worked with hundreds and hundreds of college campuses. And they've created this one resource that I'm highlighting here called Creating a Culture of Caring. And it's particularly for faculty, and it talks about practical approaches that college and university faculty can take to support student well-being and mental health. So normalizing the need for help. We know that the number one thing that students say they value most in a professor is their approachability. So being approachable, and when you're talking with students who seem to be struggling, really normalizing that mental health resources are there and they might be very valuable for you. I won't go through too much detail with each of these, because I want to leave time for the Q&A, which I'm seeing lots of questions in there. So I'm really excited to hear what people are thinking about. But there are lots of practical things that we can take, and I'll see if we can send a PDF of this around. And I would encourage folks to check out the organization Active Minds, because they've done a lot of work in this area. The last thing I want to talk about is just the importance of collecting data. So I've given a lot more caveats in this talk than I do normally, but I always say, this is what we see in the campuses in our data set. And I think in this case, there's even more reasons to be interested in how these findings might vary in the context of Asia and the enormous diversity across institutions and locations within Asia that are represented here. But really, to inform any programs or policies, it's best to start with collecting population level data. So data can be used to inform prevention and early intervention efforts. I come from the Healthy Mind study, so I always try to share the opportunity with folks to participate in that. We have our student survey, which I shared data from, and now we have our faculty and staff. So we piloted the survey just with faculty, but this year it's among faculty and staff. So combining those two surveys, you can survey the entire campus community, students, faculty, and staff. And these are online surveys, open to all institutions worldwide. They can be translated into other languages. We have a number of data reporting initiatives that we take on with our schools to give them the data back in a way that is useful to them. So a data report, an online data interface where you can generate graphs and you can compare to peer institutions. So if there were a consortium, for example, of United Board institutions, we would be able to make it such that you could look into the data interface and say, how does my institution compare to the other United Board institutions that have participated in Healthy Minds on any number of outcomes? Our, mental health screens. We also measure substance use, mental health service utilization. It's a very comprehensive survey. And we have an amazing team that's happy to work with folks. And there are a number of other surveys, and we also make our questionnaires publicly available on our website. So we've also had some international partnerships where it made more sense for folks to kind of administer the survey on their own using some of our questions, and that's also perfectly fine. Really just want to underscore the importance of collecting these data to inform practice and policy on campus. So with that, I will stop the formal presentation and just thank everyone so much for joining today. This is such a incredible crowd, and I really look forward to seeing which questions have popped up.